If you're obtaining a point-of-care glucose reading, should you get a capillary sample from a finger stick, or is it okay to use a venous sample? About 15 years ago, a higher level provider told me I shouldn't be getting blood glucose readings off of the blood from my IVs, that I should only be getting it from my finger sticks because the capillary samples were more accurate. I was happy to pivot to this, and so after that, for the time being, I got my samples almost exclusively from finger sticks. But something I also did was, if I was getting an IV line on that patient, I also got a sample from my IV, and I compared the two. And over like a year, I didn't find that there was any clinically significant difference, not to the degree that I would have failed to perform an intervention I should have, or where I performed an intervention that I shouldn't have. But that is completely anecdotal. What does the data have to say? First of all, the data universally confirms that there is a difference, but the devil is in the details. The bulk of the data that we have comes from patients who are critically ill and hemodynamically unstable, shock patients. And in these patients, capillary samples are considered to be inaccurate and capable of overestimating glucose levels by up to 36 milligrams per deciliter. In fact, venous samples are actually preferred in these patients. But on relatively stable non-ICU patients, yes, there's a difference, but not one that's really clinically significant, at least not something that's going to push you to either do something or not do something. What it comes down to is that if you get a sample from your IV and your patient presentation doesn't match what your sample says, then by all means get a finger stick. And if you want to lead with finger sticks on your relatively stable non-ICU patients, that's fine too. I'm not advising you on what you should do. You should follow your local protocols. I did look at this data individually, but if you're interested, I've used Consensus to package it nicely into something that you can read, and I will post that link in my bio or in the video description.